Well, this week, Indianapolis-based Eli Lilly and Company laid out a timeline for the return of office staff to its downtown headquarters and other facilities as well. Lilly CEO Dave Rick says the company anticipates having a full return of staff by July 12, barring a spike in COVID-19 cases in Marion County. But starting June 1, the company will be opening with 25% capacity of office-based staff. Lilly office workers have been working remotely since March of 2020. Employees will be required to have been vaccinated, wear masks, and practice social distancing. Well, Paws Think says it has two reasons to celebrate this spring. The Indianapolis-based nonprofit is marking its 20th anniversary, and its pet therapy dogs are now able to get back to in-person visits at hospitals. Business of Health reporter Kylie Valletta has more. Kylie.
Thank you, Gary. Paws Think provides animal-assisted intervention, more commonly known as pet therapy, in central Indiana. Unlike service dogs, pet therapy dogs have one mission: to make the person they're visiting feel better mentally and emotionally. In-person pet therapy visits came to a screeching halt when the pandemic hit, but Paws Think Executive Director Kelsey Burton says hospital doors are now beginning to open again to its four-legged visitors. She joins me now to tell us more. Hi, Kelsey. Thanks for being on the show today.
Hi, thanks for having us.
Okay, I can't introduce them, but I know you have another guest with you.
I do. This is Hermie. He's one of our virtual therapy dogs, so he does a lot of virtual visits for us.
Okay, very good. Well, let's start with a quick introduction to Paws Think. Just tell us a little bit about your mission and how it actually takes you far beyond hospitals.
Yeah, so our mission is to improve lives through the power of the human-dog connection. And we do that through two methods. One is our animal-assisted intervention or pet therapy program. And that's where we take trained therapy dogs to over 60 different locations throughout central Indiana, including schools, libraries, elder care facilities, hospitals, and we do a lot of support groups as well. And then we also have a youth canine program where we pair up at-risk youth with shelter dogs, and the kids train the shelter dogs in basic obedience skills.
All right, well, the great news that we're talking about today is that a lot of people think of you with the hospital visits, and you're able to start doing those in person again. So tell us what you're able to do now and the response that you're getting.
Well, we're really excited that, yes, our dogs are able to go back into some of the hospitals locally. We are able to go back into Ascension St. Vincent, and we're able to visit with the associates. So that's, not patients yet. We're getting there hopefully soon, but we are able to meet and greet our associates or the staff at the hospitals. And, one of the days we walked in, the staff cheered, there were tears. People were just so happy to have that mental health break that they've longed for. One of the associates even said the thing she missed the most during the pandemic were our therapy dogs. So that meant a lot.
And do the dogs seem to be excited about it too?
Oh yeah. The dogs, the handlers, our volunteers have missed their work, whether they're dogs or people. They've really missed being able to be out there and to just provide that unconditional love that a therapy dog can bring.
All right. Well, I think there's no substitute for an in-person visit from a dog, but the pandemic really forced your organization to innovate. So tell us about some of the virtual things that you have now in place that you probably wouldn't have even thought of if it weren't for the pandemic.
Yeah. So, yes, the pandemic, we love to have the dogs, in person. The pandemic stopped that. But one of the things we started was a program called Paws to Connect. And that's a program that we run every Saturday. It's open to the general public, and you can have a virtual visit, just like with Hermie, like what I'm doing here with him, for people that just need that happiness that a therapy dog brings. If we hadn't had the pandemic, we probably wouldn't have started this program. And what we're finding is we're able to meet and, greet with people that really need this in different settings. Like if they're in at-home hospice care, or if they're, in another country. We've even had visits with people in Canada before. So, it's just really great. And it's another way for us to be able to, bring the power of the human-dog connection to people that need it most.
Well, and the other big news is it's your 20th anniversary, and you have a fundraising campaign to go along with it. And you say that's really important right now because your funds have really dried up over the last year. Tell us about that.
Yeah, right when the pandemic first happened, we had a lot of funding that came forward for pandemic relief, which was great. But what we've seen the trend happen is they're really pulling a lot of support for mental health. And what they're doing is putting it towards basic needs like food and shelter, which of course is insanely essential, but so is mental health support. So we are starting to see some of those fundings, like you said, dry up. So for our 20th anniversary, we're trying to raise $20,000 to just bridge that gap in funding that has dried up. And we're a little over 50% of the way to our goal right now. So So we'd like to get that by May 21st if possible. And you can donate by going to pawsandthink.org/donate20, or you can text PAWS to 74121.
Okay, we only have a few seconds left, but I think it's interesting. One thing you mentioned off camera is because of social distancing and masks, you actually had to retrain the dogs a little bit. So tell us just quickly about that.
Yeah, we had to get the dogs comfortable to the smell of hand sanitizer. You know, they're having to hand sanitize before and after interacting with our dogs, which is great for safety, but not so great for a dog who can smell things way more strongly than humans can. And masks, I mean, they do read facial expressions just like people do. So we've had to, in our retraining, just get our dogs used to some of the new normals that they're going to see when they're out in the community.
All right. Well, thank you so much for joining us, Kelsey. Thanks to Hermie. I feel calmer and better already. Thanks for being on the show.
Thank you so much.
All right. Gary, back to you.
All right, Kylie, thank you.